Tonight, Governor Bullock issues a travel advisory to slow the spread of COVID-19.
I want you to do 10 push-ups. So
tonight, a principal's viral challenge to keep interacting with kids while school is out.
The president said he's cutting red tape, so some drugs already out there to treat other ailments could be used to treat coronavirus patients. And Congress goes to work on phase 3 of a relief bill. I'm Scott Thuman in Washington with what these new developments may mean.
Plus, it's a sunny but breezy first day of spring. Chief Meteorologist Mark Haka looks ahead to the weekend and when our next weather maker arrives.
NBC Montana News at 5 starts right now.
New developments as we come on the air. Governor Steve Bullock issues a travel advisory for anyone who's traveled internationally. So here's what it means. If you've traveled internationally, you are advised to self-quarantine for 14 days and contact your local health department after your return. Bullock says prevention is our best tool for combating COVID-19. This after the State Department advised U.S. citizens abroad to return home unless they're staying for an indefinite period of time. They also say international travel should be avoided. As of right now, there are 12 cases in the state of Montana. Today, Governor Bullock also asked schools to make a plan if there are future closures. He asked administrators to make sure students continue to receive necessary services. As of right now, no decision on any future closures. Bullock directed schools to close for 2 weeks until March 27th. If schools stay closed past next week, districts won't be forced to make up lost days at the end of the year. This if the Board of Trustees approve the district's plan that the lost time will be made up through remote learning. And meals and services to students with disabilities will be provided for students. Today, Stevensville Primary School offered at-home learning items for students. Students and parents checked out Chromebooks and other educational items. Officials limited the number of people allowed in the building at one time to meet social distancing guidelines. With schools closed and kids at home, keeping them occupied might get a little difficult, but two principals from Superior want to help. Brady Brewster explains.
Good morning, Superior Elementary.
Good morning, Superior Junior Senior High School.
This is the principal's viral video challenges of the day. Is this thing on?
Logan Labby is the principal at Superior Elementary School. Chris Claremont, the principal at Superior Junior Senior High School.
We're going to come to you guys every day live on Facebook, show you what's going on at the school while you're not here, and give you a challenge every day to do at home with your families.
The pair says the idea for these challenges come at a challenging time.
Nobody's prepared for something like this. So it was just an opportunity for us to again, connect that positive relationship with the kids.
Like Principal Labby said, the two give challenges to students each day they're not at school. Day one's challenge.
This week, I want you to learn how to tie your shoes.
Now that applies to high schoolers as well. If you don't know how to tie your shoes, you might want to work on that.
And within the first 3 days of posting the challenge, reactions have been great. Parents commenting thank you to the principals, but also sharing how much their kids love the videos and can't wait for the next.
I think it's having a far bigger impact. We were just making goofy videos for people to get a kick out of it and still stay engaged with the school, but you know, it's having a bigger impact than I think we planned on.
And they want it to keep growing.
For every principal in the state and the country to start dropping these videos, and just it's such an easy 5-minute connection, and you can reach so many people in such a fast amount of time.
They also added, while it's mostly for entertainment, it's also a great way to pass along valuable information. But the biggest reason for the daily challenge is,
no matter what's going on, we're always still a school family. We love the kids that are in our buildings, and we're going to keep that positive relationship no matter what.
Two men bringing some light during a time that many are finding to be very dark. In Missoula, Brady Brewster, NBC Montana.
Some changes at the Missoula YMCA to tell you about. The fitness facilities are closed, and now the Y is partnering with schools to come up with emergency child care services for families that have to work. Leaders ask members to try to continue to pay their dues so the organization can try to meet the community's needs. The Missoula Children's Theater and Missoula Community Theater are experiencing the financial impact of the COVID-19 outbreak. They are looking at a $1.5 million loss in revenue through May alone. MCT is one of Missoula's largest employers, employing more than 120 people. They've canceled their spring break day camp and remaining performances and rehearsals. Their most proactive move was to cancel their entire spring tour. That's 256 weeks gone. They've also released the 66 touring artists and teachers out on the road. New numbers today show more than 10,000 confirmed COVID-19 cases in the country and more than 160 deaths. As a result, the Food and Drug Administration is now fast-tracking the development and testing of drugs to treat the virus and may have found some new options. Scott Thuman has the latest from Washington.
In another sign of dire times, ships from Carnival Cruise Lines may soon be used as floating hospitals. That's just one of the announcements from the White House task force today, as the president claims progress on medical solutions.
I've directed the FDA to eliminate outdated rules and bureaucracy so this work can proceed rapidly, quickly, and fast.
Scientists and doctors believe they are close to possible breakthroughs, like using drugs already approved for malaria or arthritis that may be effective against coronavirus.
We are looking at everything that's coming across our desks. We have over 17,000 people at FDA who are doing this every day.
Even then, a vaccine trial could take 12 months. The long-term prospects, coupled with another reality, unemployment claims rose by a third last week, with furloughs and layoffs looming. Congress now working on phase 3 of $1 trillion worth of help, with tax breaks, direct checks to Americans, and a rapid injection of cash to help small businesses survive.
It's not an ordinary policy, but this is no ordinary time. The American people need help, and they need it fast.
Until then, food lines like this drive-up site in Delaware are becoming more common, just as mobile testing tents such as this one in Florida are too. Meanwhile, it's unclear how voting on the House side for new relief bills would take place. Since they are now home, some have tested positive and others are in quarantine, and right now, remote voting is not allowed. On Capitol Hill, I'm Scott Thuman.
A heads up to veterans, call before visiting a VA clinic. And VA doctors want you to know that you can get some of your questions answered online. This is possible through My Health Vet and the VA Video Connect app on your smartphone, tablet, or computer. But if you have a fever, cold, cough, or flu-like symptoms, this will make it easier so you don't have to leave the house. More information about COVID-19 medical whodunit we told you about first last night at 10. A Centers for Disease Control study tracked down the origin of the virus that swept through several Washington state long-term health facilities. Researchers blame several sick staff workers who spread the coronavirus among elderly patients. COVID-19 sickened 81 residents, 34 staff members, and 14 visitors. Infected staff members included those working in physical therapy, occupational therapy, and nursing assistants. At least 30 coronavirus deaths have been linked to Life Care Center in Kirkland, Washington. Officials also discovered the facilities didn't have enough personnel protective equipment or other items, such as alcohol-based hand sanitizer. Life Care officials have not commented on the CDC's findings. Again, make sure to stay with us on air and online as we continue to monitor the spread of the coronavirus. We'll continue our coverage and bring you any new updates. We've got a special tab at the top of our website, NBCMontana.com. You'll find information there from call center numbers to breaking news.